Hello, I'm Dr. Khan, one of the GP partners and the lead GP who performs minor surgeries at the practice. I'm here to talk to you about minor operations that can be carried out right here. Many patients don't realise that a wide range of procedures are available locally, making it easier and more convenient for you to get the care that you need. Minor operations refer to procedures that are typically low risk and don't require any hospital stay. These are performed in the GP practice by trained healthcare professionals such as myself, and in most cases they are done under local anaesthetic, meaning you stay awake during the procedure. These operations may seem small, but they can make a big difference in improving your health and quality of life. So let's go through some examples of what can be done right here at the practice. We commonly remove a wide variety of skin lesions, which include skin moles, skin cysts and warts that may be causing discomfort or concerns. We also offer a wide range of joint injections with the aim of relieving pain and inflammation in the area injected, such as the knee, shoulder, elbow, hand. It is also important to know that we do not operate on patient faces or do any cosmetic procedures. We also do not do any ingrowing toenail excisions or removals at the practice. So what should you do before the procedure? You must not shave or remove any hair from the area being operated on, as this can increase the risk of infection. Your surgeon will safely remove any hair on the day if required. You must not stop any medication before your procedure. If you're taking medication to thin your blood, please let the surgeon know this prior to the procedure being performed. You should plan on how you're getting home and consider if your operation will affect this. If we are doing any injections to your knees or your shoulder, then you may find it difficult to drive home afterwards, and we recommend not to drive for at least 24 or 48 hours after these type of procedures. Please try to have a good meal before your procedure and do not skip any meals. If you're a smoker as well, please try to stop smoking, as this may increase the risk of infection. When you arrive, the surgeon will confirm with you exactly what the operation involves and why we are doing it. The surgeon will then spend a few moments assessing the lesion again. You will be awake throughout the entirety of the operation. We use local anaesthetic to inject around the skin lesion to numb the area. This will feel like a small sting, but will only last for a few seconds at most. After this point, your procedure should be painless. You will feel some pushing and pulling, which is uncomfortable, but is completely normal and shouldn't be painful. Most minor surgery does require stitches to be used, and depending on the procedure, we may use stitches that can be dissolvable or stitches that may need to be removed at a later date, which we will plan with you following the procedure. Finally, a dressing or a bandage may be used to cover the operation site where possible. The entire procedure itself will last no more than 20 to 30 minutes. Any skin lesion that we do remove is sent to the laboratory for testing. This is to confirm that nothing significant is found. However, on the rare occasion that the lab may find something more concerning, it's important for us to know this so that we can act appropriately. If your stitches need to be removed, we will give you an appointment for this to be arranged. Commonly, stitches can be removed between 7 to 14 days, depending on the procedure that is being performed. We may also give you a spare dressing to take home in case there are any issues. However, it's important not to disturb the dressing that we place on the wound in order to reduce the risk of infection. Following the procedure as well, we advise not to get the area soaked when you have stitches in place, because this can lead to wound issues and wound breakdown. Ideally, you can have a shower, but avoiding the area where the operation site has been. You can return to normal activities straight away, but we suggest avoiding any heavy activities such as exercising, which may put stress on the area for at least a week. Now, minor surgery is a very safe procedure in general. However, there are some common or potentially serious complications. The procedure may leave a scar. The size and width of the scar is variable and will depend on many factors. If you've had any issues with scarring in the past, you should make the surgeon aware of this on the day. There is a very small risk of bleeding from the wound itself, and if this does occur, you should be able to control this by applying 10 minutes of continuous pressure to the wound. If after 10 minutes this does not stop the bleeding, you should contact the practice or 111. It is very rare, but a wound can become infected a few days after the procedure. If this happens, please contact us, as you may require some medication. Remember, following our advice reduces the chances of any complications. The clinician will be happy to discuss these general risks or any specific ones prior to your appointment. Once you are happy with all the information discussed, and we are confident that you have no more questions, you will be asked to sign a consent form for the procedure being performed. We look forward to seeing you for your operation, and if you have any other questions in the meantime, please feel free to contact the practice.